Suffering from sleep apnea can affect a variety of aspects of life, when you're both asleep and awake. Some male sufferers can find they have erectile dysfunction from the condition, having a damaging effect on their sex life, mental health, and confidence. In this video, we explain how getting treatment for sleep apnea can help with erectile dysfunction. What's the connection? Many may assume that erectile dysfunction is a byproduct of sleep apnea because you're tired. This is in part true, but it's a little more complex than that. Sleep apnea of this nature is so-called obstructive sleep apnea, OSA, and is, in fact, the most common form of the condition. When you suffer from OSA, you can actually cease breathing mid-sleep, one of the causes of snoring. This, in turn, leads to restless nights in bed. As a result of OSA, men can suffer from issues with their levels of oxygen, as well as their testosterone. Both of these are required when it comes to getting an erection and performing sexually. The ins and outs of this are still a little unclear to scientists studying in this topic, but the figures prove that men with OSA have a higher rate of erectile dysfunction, thanks to the lower amount of testosterone in their bodies. The main link here comes from erectile dysfunction in the body's endocrine system, thanks to a person suffering from a sleep disorder. Sleep apnea symptoms. Some symptoms of sleep apnea are loud snoring or heavy breathing while sleeping, not breathing while you sleep, suffering from a sore mouth or dry throat after you wake, feeling overly dehydrated in the night and the morning after, waking suddenly, struggling to catch your breath, headaches, fatigue during the daytime, and being prone to nodding off, issues with concentration. Then a byproduct can be suffering from erectile dysfunction. Treating the condition. There are various ways to help with erectile dysfunction, but if it's related directly to a sleep apnea condition, here are the best methods. Continuous positive airway pressure, CPAP, is often proved to improve erection performance. In this instance, a mask will be placed over the nose to help with air pressure. The idea here is to raise the oxygen and testosterone levels in the body, therefore allowing a healthier erection. Tissue removal can be done to clear the nasal airways and therefore help with erection problems, thanks to the increased airflow around the body. You can also try devices like upper airway devices, nostril devices, oral throat clearing devices, or an additional supply of oxygen while you sleep. This will, of course, only be doctor recommended and can include making a new air passage, jaw reconstruction, removing nasal cavity polygrips, and more. Sometimes sleep apnea, erectile dysfunction, or indeed both, can be stopped by simple lifestyle changes. Quitting smoking, drugs, and alcohol will help, as will exercising more regularly and losing weight. Allergy fighters are also excellent for breathing issues and can, in turn, help with the condition. We are here to help you with your snoring issues. We'll advise you on how to tackle and prevent it, and how to overcome the issues that follow on from a condition like sleep apnea. And if you enjoyed this video, be sure to like, comment, and subscribe.